This is the third video of a 3-part series of short videos looking at managing our mood when we have a long-term health condition. During this video, we will be looking at what emotions are and how best to deal with anxiety and low mood. The NHS is aware that finding new ways to take care of our mental well-being can boost our mood and help us feel more in control. So we may wish to consider trying new strategies to look after ourselves, not only to make us feel better, but also to improve our quality of life. As human beings, most of us will experience a range of emotions. It is part of us and something we cannot change. Emotions have two main functions. Emotions are one of the main ways our body can communicate what is happening to us. For example, if we feel scared, our body is telling us that there is danger. It is also letting us know that we need to do something to ensure our safety. Another main function is to communicate what's happening with us to others. For example, if you see someone frowning, perhaps the face may be looking flustered, maybe they're sweating a little, their posture is tense, they have clenched fists. Hopefully, you'll be able to recognize that this person is angry. So in short, emotions are ways to communicate our needs to ourselves and others, whilst motivating us to take action. Depending on various factors, including the environment and our thinking patterns, the intensity of the emotion we experience may feel so strongly that we may believe we cannot cope with it at the time. However, it's worth bearing in mind that emotions are temporary. They come and go, and if we are able to stay with them, it is likely they will subside in a relatively short period of time, of around 20 minutes. On the second video of this series, we looked at how to recognize feelings of anxiety and low mood. Now, we're going to look at what we can do to deal with these emotions. The reason that we, as human beings, experience anxiety is to protect us, to keep us safe. So, if our bodies perceive danger or risk, whether the danger is real or not, it communicates that to us in order for us to seek safety. Similarly, if we feel low in mood, this is our body telling us that we're sad and inactive, and we need to become more active. Looking after ourselves on a regular basis helps us to cope better with our emotions. Trying to maintain a healthy lifestyle by eating a balanced diet, trying to exercise regularly, whether walking, cycling, running, doing some exercise at home, or just moving our bodies can be helpful. So is ensuring you have between 8 and 10 hours of sleep every night. Also, stopping smoking or keeping consumption of alcohol and other mind-altering substances to a minimum. Keeping to a routine is also really important. Trying to go to bed and wake up at the same times every day and having 3 meals a day, for example, can support our routine. We may be able to incorporate some body stretches, walking our dog or feeding a pet, or anything else that it is important for us on a daily basis. When living with a long-term health condition, we may feel like withdrawing from social contact, but as we are naturally social beings, it is important to maintain good social networks. This may be by meeting or speaking to someone, maybe a family member, a friend, or even a professional on a regular basis. It may be joining a club or support group with others in similar circumstances as us. It can be difficult to look after ourselves on a regular basis when we are living with a long-term health condition, so it is important to be realistic about what we are able to manage and be kind to ourselves. We are often very quick to be self-critical. It is vital to treat ourselves as we would treat someone we love. Self-criticism can have a negative impact on our mental health, our overall well-being, as well as our self-esteem, confidence levels, and our ability to cope with our emotions. Thinking more specifically about anxiety and low mood, what sort of things can we do when we're feeling anxious or experiencing low mood? If we take into consideration that anxiety is a way of our body alerting us of a perceived risk, which may or may not exist, to manage this, we need to adopt behaviors that reassure our bodies that we are safe and encourage our bodies to calm down. On the other hand, feeling down is a way of our bodies telling us that we need to be active, to do something that we enjoy. Please bear in mind that as human beings, we are all different, so we need to find out what works for us as individuals. Relaxing, meditating, using breathing techniques such as progressive muscle relaxation, grounded techniques, and imagery, or using mindfulness can be helpful. There are plenty of guided apps and videos available online. Engaging with our senses can also be very helpful. Some ideas of how we can engage with our vision are to look at a picture or a video that we like or remind us of happy memories, to watch nature in person, or to look at photos or videos of nature. We can also use our sense of touch by petting an animal, having a bath or a shower, having a massage, hugging, or simply snuggle up a soft blanket. We can focus on our hearing by listening to music or some relaxing sounds. We can engage with our sense of smell by using aromatherapy, maybe burning some incense or smelly candles. Another way of dealing with anxiety and low mood is to engage in hobbies we enjoy. These may include doing crafts, drawing, painting, sketching, writing, cooking, reading, watching TV, learning a new skill, doing jigsaws, and gardening. Now we're going to do a short mindfulness exercise called Leaves on a Stream from Acceptance and Commitment Therapy, also known as ACT for short. It is a helpful technique to help us deal with difficult thoughts by observing and accepting them in a non-judgmental way. Before we begin, we would like you to sit comfortably in a chair or on the floor in a quiet and private space. Allow your eyes to close gently if you're able to, or if you prefer, fix your gaze on a point in the room in front of you. Take a couple of gentle breaths in and out to help you settle into this exercise. Allow the air to fill your lungs, your tummy expanding to let this air in, and then letting the air out of your body. Notice the sound of each breath as you breathe in and out. Now, I would like you to imagine that you are sitting at a bank with a gentle flowing stream, watching the water flow. Imagine what the ground under you may feel like, what the water flowing past may sound like, the smells around you, what the stream looks like as you watch it. Imagine that there are some trees nearby. Some leaves have fallen from these trees on the stream, and they are floating on the surface of the water. They are of all different shapes, sizes and colors. They are floating on the stream and you are just watching them. This is all you need to do for the time being. Start to become aware of your thoughts. Each time you notice a thought, imagine placing it on a leaf and letting it float down the stream. Do these regardless of whether the thoughts are positive or less positive, pleasurable or painful. Even the most joyful thoughts, place them on a leaf and let them float by. We are not trying to get rid of the thoughts, but allowing them to float by at their own speed. Sometimes you may be hooked up into your thoughts without even noticing. This is completely normal and nothing to worry about. When you notice that it's happening, just notice your thoughts and place them on a leaf, allowing them to float away. If you notice that your thoughts have stopped, just watch the stream. Your thoughts will probably start up again. When they do, just continue placing them gently on leaves and let them float on the stream. Allow the stream to flow at its own rate. Notice any thoughts around slowing the stream down or speeding it up, and place these thoughts on leaves as well. Allow the stream to flow as it wishes to. If you have any thoughts about doing this exercise, place them on the leaves as well. If a leaf gets stuck, allow it to stay there. You are simply observing in this exercise, so there is no need to do anything to the leaves per se, just watch them. If you notice any feelings, frustration, tiredness or boredom, simply notice them by saying, "Here's a feeling of frustration," and place it on a leaf as well. Whenever thoughts come to you, just notice them and gently place them on a leaf and let them float away. In this exercise, you are simply observing your thoughts and placing them on a leaf on the stream. It is natural to lose track at times and nothing to worry about. It will keep happening, and all you need to do is to notice when this happens and bring your attention back to the leaves on the stream. Whenever you are ready, try to bring your attention away from the stream and back to your surroundings. Notice the sounds around you, any feelings of you sitting, and gently open your eyes if you have closed them. Push your feet into the floor and have a stretch. Notice yourself stretching. Welcome back. We are coming to the end of this video and would like to encourage anyone who feels the need to reach out for support to do so. Here is a list of useful contacts in addition to your GP. Some of these are available 24/7. If anyone feels at risk right now, we would like to encourage you to call 999. We are finishing this video with a lovely quote by Eleanor Roosevelt that says, "Yesterday's history, tomorrow is a mystery, today is a gift. That's why it's called the present." This quote reminds us that we can't change what happened and we don't know what the future brings, but emphasizes the here and now. It encourages us to make the most of the present, whatever this may be. In summary, living with a health condition can feel like a roller coaster, especially in the beginning when we are adapting to the symptoms, the diagnosis, treatment, and a different way of living. We may still be grieving for the life we once had amidst it all. We may have good and not so good days, and it is easy to compare our circumstances to those of others, our own past, or worry about what the future holds. At times like this, remembering that we only have control over our behavior and choice at present will hopefully help us to make the most of our lives in the here and now. Thank you for watching.